Hi, my name is Christina Landrum, and I'm a first-year kinesiology major from Fairfax, Virginia.
Hi, my name is Essence Campbell. I'm a first-year psychology major from Charleston, South Carolina.
Our topic is genetic counseling.
Genetic counseling happens when someone that is at risk of a certain inherited disorder is told the odds of them getting that certain disorder. They're also informed about the consequences and what the disorder is all about, and the options open to them and how they want to manage their family and if they should have kids or not.
The National Society of Genetic Counselors, or the NSGC, promotes the professional interests of genetic counselors and provides a network for professional communications.
Genetic counseling began in 1971 when the first class graduated from Sarah Lawrence College in Bronxville, New York. This is when genetic counseling professionals quickly became an important member of the clinical genetics team.
The Society's vision was integrating genetics and genomics to improve health for all. The Society's mission, the National Society of Genetic Counselors, advances the various roles of genetic counselors in healthcare by fostering education, research, and public policy to ensure the availability of quality genetic services.
Genetic counseling helps people understand the medical, psychological, and familial involvements of genetic contributions to disease. This includes family and medical histories to help figure out the chance of disease occurrence and reoccurrence, education about inheritance, testing, management, prevention, resources, and research, counseling to help with choices and adaptations to the risk or conditions. NSGC is an important resource for patients and anyone else who wants to learn more about genetic counseling.
Genetic counselors can give you the personalized help you need when it comes to you and your family's genetic health. Genetic counselors can work with you and your physician to understand complex genetic information and help you make informed decisions. Patients benefit from speaking to another person, skilled not only in medical information given, but as another compassionate resource to repeat the information presented by physicians and nurses. As a genetic counselor, you educate individuals and their families about the effects of genetic conditions and common diseases. By tracing family history and evaluating test results, you can identify individuals at risk. With your help, families can learn how to manage their health. Your knowledge can change lives. Genetic counselors are health professionals with specialized graduate degrees and experience in the areas of medical genetics and counseling. Most enter the field from a variety of disciplines, including biology, genetics, nursing, psychology, public health, and social work. Genetic counselors provide a critical service to individuals and families considering undergoing genetic testing by helping them identify their risk for certain disorders, investigate family health history, interpret information, and determining if testing is needed.
As society's knowledge of genetics continues to expand, genetic counselors are working in nearly all areas of healthcare. Specialty traits where genetic counselors are working with patients and physicians include
assisted reproductive technologies and infertility, cardiovascular genetics, familial cancer risk counseling, fetal intervention and therapy, hematology, metabolic genetics, neurogenetics, pediatric counseling, personalized medicine, and prenatal counseling and ultrasound anomalies, and psychiatric disorders. As genetics has expanded into other areas of healthcare, genetic counselors have moved into exciting new roles. The skills genetic counselors receive in their training are opening doors to careers in
research, diagnostic laboratories, educational and medical websites, pharmaceutical industry, public health, healthcare consulting, marketing, product development, policy development, advocacy. The possibilities are endless and continue to expand. If you and your partner are newly pregnant, you may be amazed at the number and variety of prenatal tests available to you. Blood tests, urine tests, monthly medical exams, screening tests, and family history tracking each helps to assess the health of you and your baby and to predict any potential genetic testing. It helps identify the likelihood of passing certain genetic diseases or disorders to your children. Those caused by a defect in the genes, the tiny DNA containing units of hereditary that determine the characteristics and functionings of the entire body. Some of the familiar genetic disorders are Down syndrome, cystic fibrosis, sickle cell disease, and Tay-Sachs disease.
Genetic tests are done by analyzing small samples of blood or body tissues. They determine whether you, your partner, or your baby carry genes for certain inherited disorders. Genes are made up of DNA molecules, which are the building blocks of heredity. Genes are made up of DNA molecules, which are building blocks of heredity. They're grouped together in specific patterns within a person's chromosomes, forming the unique blueprint for every physical and biological characteristic of that person. People have 46 chromosomes, arranged in pairs in every living cell of our bodies. When the egg and sperm join at conception, half of each chromosomal pair is inherited from each parent. This newly formed combination of chromosomes then copies itself again and again during fetal growth and development, passing identical genetic information to each new cell in the growing fetus. Current science suggests that every human has about 25,000 genes per cell. An error in just one, and in some instances, even the alteration of a single piece of DNA, can sometimes be the cause for a serious medical condition. It's especially important to consider genetic counseling if any of the following risk factors apply to you. A standard prenatal screening test, such as the alpha fetoprotein test, yields an abnormal result. An amniocentesis yields an unexpected result, such as chromosomal defect in the unborn baby. Either parent or a close relative has an inherited disease or birth defect, or if either parent already has children with birth defects, intellectual disabilities, or genetic disorders.
The mother-to-be has had 2 or more miscarriages or babies that died in infancy. The mother-to-be will be 35 or older when the baby is born. Chances of having a baby with Down syndrome increase with the mother's age. A woman has about a 1 in 350 chance of conceiving a child with Down syndrome at age 35, a 1 in 110 chance at age 40, and a 1 in 30 chance at age 45. You are concerned about genetic defects that occur frequently in certain ethnic or racial groups. For example, couples of African descent are most at risk for having a child with sickle cell anemia. Couples of Central or Eastern European, Jewish, Cajun or Irish descent may be carriers of Tay-Sachs disease. Those of Italian, Greek, Middle Eastern, Southern Asian, or African descent may carry the gene for a red blood cell disorder. Either parent is concerned about the effects of exposures they have had to radiation, medications, illegal drugs, infections, or chemicals. Before you meet with a genetic counselor in person, you may be asked to gather information about your family history. The counselor will want to know of any of your relatives with genetic disorders, multiple miscarriages, and early or unexplained deaths. The counselor will also want to look over your medical records, including any ultrasounds, prenatal test results, past pregnancies, and medications you may have taken before or during pregnancy. When you meet with the counselor, you'll go over any gaps or potential problem areas in your family or medical history. The counselor can help you understand the inheritance patterns of any potential disorders and help assess your chances of having a child with those disorders. The counselor will distinguish between risks that every pregnancy faces and risks that you personally face. Even if you discover you have a particular problem gene, science can't always predict the severity of the related disease. For instance, a child with cystic fibrosis can have debilitating lung problems or, less commonly, milder respiratory symptoms.
If more tests are necessary, the counselor will help you set up those appointments and track the paperwork. When the results come in, the counselor will call you with the news and may ask you to come in for another discussion. Genetic counselors can help you understand your options and adjust to any uncertainties that you might face, but you and your family will have to decide what to do next. If you learn before contraception that you and or your partner are at high risk for having a child with a severe or fatal defect, your options might include pre-implantation diagnosis, when eggs that have been fertilized in vitro or in a laboratory outside of the womb are tested for defects at the 8-cell blastocyte stage, and only non-affected blastocytes are implanted in the uterus to establish a pregnancy. Or you could use a donor sperm or donor eggs, adoption, take the risk of having a child, or establishing pregnancy and have specific prenatal testing.
If you've received a diagnosis of a severe or fatal defect after conception, your options might include preparing yourself for the challenges you'll face when you have your baby, fetal surgery to repair the defect before birth, which is surgery can only be used Fetal surgery to repair the defect before birth. Surgery can only be used to treat some defects, such as spina bifida or congenital diaphragmatic hernia, a hole in the diaphragm that can cause severely undeveloped lungs. Most defects cannot be surgically repaired, or you can end the pregnancy.
For some families, knowing that they'll have an infant with a severe or fatal genetic condition seems too much to bear. Other families are able to adapt to the news and to the birth remarkably well. Genetic counselors can share the experiences they've had with other families in their situation, but they will not suggest a particular course of action. A genetic counselor understands that what is right for one family may not be right for another. We hope you've enjoyed learning about genetic counseling. This has been Christina.
In essence,
Thank you for watching.